chest pain, shortness of breath, atherosclerosis, and coronary artery disease. These are scary terms. They keep people awake at night. How's my heart doing? What do these symptoms mean? Am I going to have a heart attack? And from a cardiology standpoint, the greatest part of our job is preventing a heart attack from happening. So the big question a lot of patients want to know is, do I need a stress test? We're going to dive into that because there are some things about stress testing I don't think people completely understand. So find out today as Dr. Lacey and I are going to discuss stress testing, the top 10 facts, and some misconceptions that people have about stress testing today on Living Heart Smart.
Today, we're talking about your arteries. And like Matt said, atherosclerosis and chest pain and plaque. And what people are really worried about is having a heart attack.
Right.
And honestly, in the United States, we still have over 800,000 heart attacks a year. That's one every 40 seconds. You're right, Matt. It's way too many.
Right.
We need to talk about how to prevent those even further.
Yeah, we do a great job of prevention, but we got to do much better.
We have work to do.
Right.
And a lot of times when people are coming to us, it's well before that process ever happens, thankfully. But people still tend to have some symptoms: chest pain, pressure, tightness. It's not a pain, doc. It's a pressure that comes on when you're exerting yourself. Sometimes it can move to your jaw, to your arm, to your back, and it goes away when you rest. Sometimes it's associated with sweating, more shortness of breath than normal. Sometimes you just can't do that hill like you used to be able to do, and you just have this sense something is wrong. That's when we want to see what's happening to your arteries.
Carolyn, I know you normally really like to talk about the anatomy, but let me just do a quick anatomy lesson today when it comes to your arteries and your heart. There are three main coronary arteries: the left anterior descending coronary artery, the circumflex coronary artery that goes around the side, and the right coronary artery that we think about going around the right side of the heart or the back of the heart. Now, atherosclerosis is the term we use to describe cholesterol building up in these arteries. And this process takes decades to happen. It takes 10, 20, 30 years or more before you're going to notice any symptoms. So this process starts, cholesterol starts building up. You can have an artery that's 20, 30, or 40% blocked and never have a symptom. So that's one of the keys I think Dr. Lacey and I want to get across today, is that it takes a major blockage, A, before you have symptoms, and B, before you're going to have an abnormal stress test. So that's how the process works. Atherosclerosis takes a long time to develop, but once that artery becomes more than 70% or so blocked, that's when people start having some of these symptoms like chest pressure, chest tightness, and heaviness, especially when they exert themselves, and it tends to go away when they rest. They sort of hit that threshold where the heart can no longer compensate for the work they're putting in, and that's when they start feeling it. And then the next part of the story is, where do these heart attacks come from? When people really think about heart attacks, they say, well, how did this come out of the blue? I felt pretty good, and all of a sudden I had a heart attack. Well, that's because one of these blockages, usually less than 70% actually, becomes unstable. And there's a little cholesterol plaque in there that we call it. And this plaque ruptures and it goes downstream just a little bit. It clogs the artery.
Now we want to see if your symptoms are being caused by one of these narrowings or a blockage in your artery. Mm-hmm. We checked this out by doing a stress test. And we wanted to make sure when it comes to stress testing, people understand just a couple of things. What is a stress test? What can it tell us? But really, what does it not tell us sometimes? Yeah. I think that's a really important.
It's so important because stress tests are a great tool for us. We use them all the time to track these symptoms down, but they're not perfect and they have some limitations that we just want to make sure everybody's aware of.
Top 10 facts and misconceptions about stress testing. There will be a quiz at the end of this.
Yay.
No, I'm just kidding.
All right.
Maybe I'm not. You never know sometimes. But let's start. Number 1, stress tests are safe. Whether it's a chemical stress test or a walking stress test, they are safe. These are set protocols that we've been using for decades, and we know that they're okay to do. Number 2, there are different types of stress tests, but they are generally break down into 2 categories. So you either have exercise stress tests or a chemical stress test, which is also called a pharmacologic stress test.
So the most basic type of stress test is called an exercise treadmill test. And that's for someone who can walk on a treadmill, of course, but it's the person. We're looking for symptoms. We're watching blood pressure and we're watching the EKG. That's the extent of it. We get your heart rate up to a certain level and see how it handles the stress, and we go from there. Now, sometimes EKGs aren't always cooperative on these treadmill tests by themselves. So oftentimes we have to add some sort of extra objective layer to help us look at the heart in other ways. A very common type of stress test then is a stress echocardiogram. Same sort of thing. You're watching your blood pressure, watching your heart rate, watching the EKG. But we add an echocardiogram. That's an ultrasound image of your heart before and after the treadmill test, because we can look directly at the heart muscle to see how it's beating and seeing if it's doing everything we expect it to do. There's another type of test called an exercise nuclear stress test, which is, again, blood pressure, treadmill, EKG, but that extra layer that we're looking for is some nuclear imaging. So that's a special camera where we inject you with some radiopharmaceutical type medicines, and we can see how the blood flow to the heart is. Super accurate way for us to look at the heart. So those are the kind of treadmill ways we can look at the heart. For some of you that can't use the treadmill safely or have some changes on the EKG that are very specific, we may do what's called a pharmacologic or a chemical stress test, where you don't have to do anything. You lay there. It does require an IV, but when we inject the medication, it dilates the arteries and is very similar to exercising. Just as accurate as a treadmill. So some of you may get this pharmacologic stress test instead.
Sugar pops. So when we are giving you the stress test, we're trying to simulate what your body goes through or what your heart goes through when you're exercising. So raising your heart rate, raising your blood pressure. The response to that is your heart is working harder. And in order to get your heart enough blood flow that it needs, the arteries need to dilate. And if you've got significant or severe blockages in your arteries, your coronary arteries, they're not able to dilate anymore. And that's what we're trying to cause on the stress test, to be able to see that phenomenon happen.
Yeah, well, that lack of dilation in those diseased vessels is what causes symptoms or changes on the EKG or changes on the imaging that we can see. And that what we call ischemia, and that tells us there's a blocked artery there that potentially needs to be dealt with. Okay, so that's some of the physiology as to what happens during these stress tests. But let's get back to the very basics here. A lot of the reasons we're doing these stress tests is for symptoms. Carolyn mentioned chest pain, pressure, tightness, heaviness comes on with exertion, sometimes shortness of breath or decreased exercise functional capacity. You just can't do what you used to. Those may all be suggestive of a blocked artery. But sometimes we'll do these exercise stress tests for other reasons, like if you've passed out, if you've gotten a weakened heart muscle for other reasons. We always want to check the arteries. And sometimes it's just as simple as, hey, I need surgery on my back, or I need something taken out, and I'm not very active, so I don't know if I have symptoms or not. So we'll do these stress tests kind of in a preoperative setting just to make sure the heart's okay.
Number 4, this one's important. We've already been talking about doing stress tests for symptoms. We generally don't do stress tests if you don't have symptoms.
Right.
And I see people and they say, I think I just need a stress test because I just want to check my heart out, but they're not having any symptoms at all. And I would just encourage them to think that maybe that's not the right test to do at this time. When we talk about that, what those other tests are.
I think point number 10, and I think number 10 coming up soon may give us an idea of some other things that we can do instead of a stress test for someone with no symptoms.
Number 5, stress tests are going to find big, major, severe blockages in the arteries.
That's what they do. Yeah.
That's what they're supposed to do. We want to see if there's a severe blockage that's causing the symptoms that you're having. That's what stress test means to find.
Yeah. We mentioned, a stress test will not detect a blockage of less than 70%, but symptoms will not happen if you have blockages less than 70%. So they typically will go together. I'm having symptoms suggestive of a blocked artery. Stress test shows us a major blockage. So that's what it does.
Right.
So we're going to keep reiterating that point, I think, throughout the show today.
Yes. Number 6, Matt, you already said it. Number 6. I think that we should reiterate. There's no stress test that's perfect, right? No matter what we're doing, there can be problems with the test. And sometimes we need to do more testing just to figure that out a little further.
Very true. Yeah. Just because you're asked to do another test after that one doesn't mean something bad's happening. It means we still have a little work to do to sort out what's going on. Number 7. The results of the stress test. I would classify the results into 3 different categories. Number 1, the stress test is normal. Hey,
yay!
When we checked out your symptoms, the stress test didn't show any major blockages in the arteries. We don't think the symptoms you're having are coming from a blocked artery, and we're good to go, and we move on. So that's great outcome. Number two, abnormal stress test. You're having symptoms of chest pain. The stress test suggests there's some abnormalities there that can occur. And then we have to go on to do some other testing. I can just tell you, we've had so many patients come through. Chest pain comes on with exertion. We do a stress test, shows some abnormalities. We try some medications to calm things down, but ultimately, many of those people will go on to have what's called a cardiac catheterization or an angiogram, so we can look at those arteries directly. And sometimes they end up with a balloon or stent to open those vessels. Symptoms go away, and we're good to go. So an abnormal stress test does need some follow-up, either medications or sometimes some interventions to fix those arteries and help us prevent heart attacks for sure. The third category of stress testing is less fun, but it's what we call a non-diagnostic stress test. As Carolyn just talked about, no stress test is perfect or no test is perfect. And so that's where maybe part of the test shows some changes, but the other part doesn't, or you feel good and they're just not jiving. And Carolyn and I have to be able to look you in the eye after the stress test and tell you one way or the other. Your arteries are good, keep exercising, or your arteries are a problem. So when we get one of these non-diagnostic tests, you're probably going to get another test to check you out.
I call it a tiebreaker test.
Oh, I like that. Yeah.
Yeah, because it's one of those things where some things look okay, some things don't look okay.
Right.
Now we need another test.
You're still not sure.
We're still just not sure.
positive.
We need to be sure. Right.
Okay. Yeah.
Okay. Number 8, let's give you some pearls when you're actually showing up for the test. Because people want to know, what do I expect when I show up?
We get some common questions.
We do.
Try to clear that up.
So if you're having an exercise test where you're going to be walking, it's really important, wear comfortable shoes because you are going to be walking. The other question that I get is, how long am I going to be on the treadmill? People are worried this is their workout for the day, that they're coming, run on the treadmill for 30 minutes like they see people doing at the gym. That's just not the case, thankfully. Most people's treadmill tests are going to last somewhere between about 3 to about 10 minutes. At that time frame, you're going to be walking on the treadmill. It'll be brisk. It'll be a brisk walk, but it's all uphill.
A little up incline. It changes every 3 minutes. It makes you work harder and harder to get that heart rate up. And Carolyn, just to give people an idea of because we have to have you hit a certain target, what we call a target heart rate in order to make the test accurate. And that's 220 minus your age times 85%. Now, you don't have to remember that, but that may give you a ballpark as to what we're trying to do to get your heart rate up. Because someone who's maybe overweight and deconditioned, the heart rate goes up really quickly, and we get that answer in 3 or 4 minutes. But for somebody who exercises all the time and has a nice slow heart rate to begin with, you're probably going to be on the treadmill longer.
Right. So let's talk about one of the misconceptions I hear. Number 9, my stress test is normal. My heart's okay.
Right.
My heart's okay, right?
Well, yes and no, I guess.
Yes and no, right? We don't want the stress test to be abnormal before you have to start making some changes that you probably need to make, right? Don't we all need to keep working on our lifestyle habits? We all need to be exercising and working on our nutrition and not smoking, all of those things. So if you know you have changes that you need to make, sometimes around exercise, a lot of the times, a normal stress test means it's okay. And it's safe for you to start doing that.
So I just would reiterate what you said there, just because so many people, they maybe aren't living the best lifestyle. They know they need to make changes, but the treadmill or the stress test was okay, so I'm good to go. But as we've mentioned a few times, it just means there's no major blockages in the arteries. Still make all those lifestyle changes as best you can, because you just don't know from a stress test alone.
And I think that kind of leads us to number 10.
Number 10, what other ways are there to check out my arteries? We mentioned that doing a stress test for someone with no symptoms is not something we typically do, because stress tests only detect major blockages. So I think a great tool is a coronary artery calcium test. It's a non-invasive test, CAT scan of your heart. There's no IV, there's no prep. It takes 10 or 15 minutes to do. And it's one of the only tests that can look inside your arteries non-invasively and tell us if there's any plaque building up early. And that is a non-invasive way to tell you how your arteries are doing. If there's any blockages or anything brewing in those arteries, less than 70% that a stress test will not detect. Now, the coronary artery calcium test is not for everyone, but it's a great tool. You should ask your doctor about it. And for my bang for the buck, I think it's one of the greatest things, especially our younger patients, 40, 45, 50, 55 years old, should be doing. And yes, for us, those are our young patients for sure.
I think that pulls it all together with our top 10 top 10 facts and misconceptions about stress testing.
Yep.
So hopefully you remember symptoms lead to stress tests. Here's what you expect from your stress
Right.
test. And it doesn't tell us the whole story. We did talk a little bit about calcium scoring today too. So if you're interested in learning more about that, please refer back to our episodes with Dr. Jason Liu talking about calcium scoring.
Yeah, it's a good one.
Yes. And if we'd love to hear your feedback, and if you have ideas for topics, please let us know. Thanks a lot for listening to Dr. DeVane and I on Living Heart Smart.